Father, Son, the Holy Spirit on God. Thanks God who has given us for the opportunity to talk with the people, especially for the young people all over the world. And thanks also for Dr. Michael Bishara. He has a specialist for taking care for the people and especially in the addiction type and addiction branch of the life of some people. They have attacked by some of these drugs with many types of these drugs. But first of all, we would like to think what the purpose of the person who start to use drugs or other things. First thing, he, of course, far away from God, no prayer, no Bible, no church, no confession, no communion, and he start to think how to live in a free life. And second thing, he feel nobody care for him and listen to him in home, even in the university or in the school or the streets, on any social meetings, even maybe in the church. Sometimes he went to church for prayer, but there is no any feeling or cooperate with other people to feel that he has his own personality with the people, and he can respect the people and the people respect him, and also he can feel free to talk with others. All these things. Other side, there are some people would like to drag the people, this person, to be with them in the other life, to be drunk and many things like that. He started with the small things, and by time he grown up to be one person. He cannot far from these drugs or drink. And also he cannot leave these friends attract him in the way, and some result will appear. Of course, money and his personality, he thinking he's taking care of himself. He feels that he lost himself, lost his life, lost everything. And after that, some people or himself would like to treat himself to protect and to prevent and to protect himself from growing up and complete his life with this way. If he feels that he need to live this life and live with these people and go return again to his very good life with family, with the university and school and with the church, if he need by himself, then he will find the way, and of course he will recover from this very bad way of his life. But if some people push him for treatment, I think there is no result, because first thing, the ability to live this bad life and would like to return back to a good life, he will be succeed to return back in very good life. We thank very much for Dr. Michael Bishara, because he is a specialist and famous person for treatment and taking care for these people with many sides, spiritual side and psychological side, and also with the medical side. He succeeded in many cases he made, and I visited his place. I found that many people came and feeling happy with his way to keep them in a very good life and very good way. Thanks for COIC channel, because taking care for the young people and older people to prevent them from this bad way for drugs and other things. And also thanks Dr. Bishara because he succeeded in many ways and many people to keep them in a spiritual life and also psychological life and also regular life with the people, with the family and with the friends in the faculty or school or in the social life.
Welcome back to Stay in Control. In the previous episode, we talked about vaping and the types of addiction. So how can people stop or prevent addiction?
The addiction, like any other disease, okay, there's something we have to understand. There is two types of diseases model. One is the acute model, which is very simply, I have a cough, I have a cold. 2 or 3 days, maybe 9 days, and it will be gone. And I don't have to deal with that anymore. Okay, it does not affect my life. But there is other diseases called the chronic disease versus acute. Acute, as we said, a cold, bronchitis, something you did, you have, treated, done, gone. But there are other form or models of disease called the chronic diseases. And very simple, like hypertension, like diabetes. Did you ever know somebody lost his diabetes? No. He continues to be diabetic until the day he dies. People with hypertension, they continue to be hypertensive no matter what. Okay? But there is in that model, addiction falls in that model. Once addiction starts, there is no cure, there is control. For example, we'll go back to the diabetic. When I become diabetic, my blood sugar is high. So if I am standing with somebody who's normal, you can check my blood sugar and say, this is high, check his normal. If I get treated from diabetes, then my blood sugar will be normal. And the normal guy, you cannot differentiate. We both have normal blood sugar. But my blood sugar, it's low because I treated it. What happened if I stop the treatment? It's going to go right back up again. All this is introduction. I'm trying to give the parents, give people the importance of prevention. Because once addiction starts and becomes an addiction and it affects the brain, very, very difficult to treat. And when you treat it, you're treating as if you have high blood pressure and you're taking your medication. If you stop taking your medication, it's going to come right back. So for the treatment of drug addiction, we have 2 ways now. We have something called MAT, which is called medication-assisted treatment. Okay? And there's 2 medications for this. One for opiate, and the other one for alcohol and opiate. Okay, there is a third one for opiate only. But this requires a doctor's under the treatment of a physician. And the patient need to continue taking his medication. Gina, I'll give you an example. What is the chances of somebody who stopped drinking 15 years ago? And he's going to AA treatment or groups every day for the last 15 years, never had a drink. What is his chances of relapsing? I know it's very, very difficult to understand. We all think, hey, 15 years he didn't drink. He's going to meetings every day. So his chances are nil to relapse again. But practically it's 50%. 1 out of 2 will relapse again. So it is a disease. It looks very bad. It looks, yes, it is. I would rather prevent it than treat it, okay? So we'll talk to the parents how they prevent this disease. But let me finish up with the treatment. So the treatment is to go to an episode, to go to treatment. But the difficulty here is, as Sayyidina in his introduction said, it's difficult and people push him to do things. And the more the people push, the more resistance he gets. Okay? To go into treatment, there is a model called motivational intervention or motivational interviewing, okay, which goes through steps little by little and makes this person able to go to treatment, okay? But you cannot go from this stage to this stage. We'll fight you and you will get nowhere near it, near the result. But that's why I said, let's go to the professionals in addiction. Like this dad, which I mentioned in the 2 episodes before, he was saying, my kid will never do drugs again because I'm on him like a hawk. And I looked at the kid and the kid is high. So although the parents trying to do their best, and I asked him, when did you get high? When was the last fix? He said 2 hours ago in the bathroom. So whatever the parents did is not effective. So we need to go to the professional and they will take him through the steps of motivational interviewing and then go on to the treatment phase, detox part, and then the treatment phase, and will continue. But after the treatment, he has to continue with AA meetings and with MAT. For example, the national statistics on MAT, which medication-assisted treatment, is 70% success sobriety in 1 year. You know what's the average without MAT? Less than 2%. And 98% they already relapsed. Versus 30% of people who relapse on MAT. But at least we have very good results with MAT. I have people that have been 8 years in my practice, they didn't relapse. And if they relapse, we'll bring them right back. It will be an episode of a slip rather than a full relapse. So this is how to treat. And I want to stress to all the families, if you're dealing with an addicted kid, the treatment is not, you just go to treatment and when he comes out or she comes out, it's not a cure. If they don't go and follow with the doctors, follow with the AA, follow with NA meetings, they will relapse again. And we have seen it so many times. So it is a difficult disease to treat, but also it could be treated. But you have to follow. And the role of the parents, the role of the mother, the role of the wife, role of the husband is to make sure that this person continues with the AA meetings, continue with the medication as the doctor recommends. So this is how to treat. Now, how to prevent it, which is more important, okay? We don't want to get to addiction, but how to prevent it. First of all, nobody, out of nowhere, he will start addiction. You will see, the parents will see the pre-existing conditions that leads to addiction. For example, if my child is not sleeping, my child is anxious, my child having problems with his friends. This should be my first alert. It's not like he is okay, he will be okay. No, he's not going to be okay. Because once you have these symptoms, remember, drugs addiction starts early. So if he's not sleeping, he's going to look for something to make him sleep. If he's anxious and he's not comfortable within his skin, he will go to drugs. If he has ADD or ADHD, he will start looking for drugs early in life because his brain is so scattered that he's tired of his brain. He wants to think, but he's thinking about 100 things at the same time and not finishing any task. This person is really feeling miserable, and he will go and look for other things to help him to feel better. So this is the gravity and the importance of how these symptoms, the psychological symptoms, will definitely how it's going to lead to a drug addiction. I need to, when I have a child that is acting or have an abnormal behavior, that requires me to take him to the psychiatrist right away to find out what is wrong. He could be anxious, something could have happened to him, something happened in the school, some kids bullied him, but now I have a problem. Now I need to treat this, because if I lift it, it's going to go into drug addiction.
Thank you, Dr. Michael Bishara, for sharing this information. Thank you, CYC viewers. Stay safe and God bless you.